This is the model of the duodenum along with pancreas and spleen. The head of the pancreas lies within the C-shaped concavity of the duodenum. The pancreas as a whole is directed upward, backward, and to the left. The spleen, the long axis of the spleen is directed downward, forward, and to the left. And the superior border of the spleen is notched. Now, let's see the interior of the duodenum. This is the superior duodenal flexure. Superior duodenal flexure. Which is the junction of the first and the second part of the duodenum. This is the second part of the duodenum or the vertical part. Third part of the duodenum or the horizontal part, and this is the ascending part or the fourth part of the duodenum. Now, let's have a look at the interior of the duodenum. This transverse force, these are the plica circulars. Plica circulars. This is the major duodenal papilla. Major duodenal papilla. Above it lies the plica semicircularis or the monk's root, and from the major duodenal papilla is the longitudinal muscle fold. This is the plica longitudinalis. Now, at the major duodenal papilla, opens the main pancreatic duct as well as the common bile duct, forming a hepatopancreatic ampulla, which are guarded by sphincter of the Oddi. Now, this is the minor duodenal papilla, which is located 2 cm above the major duodenal papilla and receives the opening of the accessory pancreatic duct. Accessory pancreatic duct or duct of Santorini. Major pancreatic duct or duct of Hirschsprung. Now, this main pancreatic duct, it is formed by a herringbone pattern. A herringbone pattern forming this major pancreatic duct. Looking at the interior of this pancreas, above the tuber ementally. This is the tuber ementally. Above the tuber. Now, this part of the part of the pancreas within the concavity of the duodenum is the head. Then the part of the pancreas just in front of the portal vein. Formation of the portal vein is the neck, and the part of the body and the part of the pancreas that lies to the left from the left margin of the portal vein is the body, which extends up to the surface, which will actually extends up to the kidney, up to the left kidney, hilum of the left kidney, and the part of the pancreas within this lineorenal ligament that lies within the tail of the pancreas. Now, above, this is the splenic artery, transverse splenic artery. Posteriorly is the splenic vein. This is the inferior mesenteric vein. These are superior mesenteric vessels which will pass in front of this uncinate process, This is the celiac trunk. Celiac trunk, it has 3 arteries. Splenic artery, which is the largest branch, and the left gastric artery, and the common hepatic artery. This part, common hepatic artery, gives gastroduodenal artery. This part, gastroduodenal artery, and the hepatic artery proper. Now, this is the portal vein. Portal vein, it is formed by the union of the splenic vein and the superior mesenteric vein at the level of the lumbar 2 vertebra behind the neck of the pancreas. And on the side, this is the common bile duct. Common bile duct, diaphragmatic surface, visceral surface, superior border, and the inferior border, anterior end, posterior end. This is the colic impression. This part becomes the pancreatic impression. This is the gastric impression for the stomach, and behind is the renal impression for the left kidney.